I'm tasked today to talk about ketogenic metabolic therapy. So later on, if you have questions, just ask me if I'm still here, because this slide deck contains very many slides, and I'm just filtering the slides specifically for this presentation today. Okay, so we are here for the conundrums in neuroscience, and that's the theme for our conference. So indeed, ketogenic metabolic therapy is a big conundrum to many of us, even doctors worldwide, because I've been there, I've done that. It's a big conundrum, really. Okay, so I hope I will be able to shed some light to you all with regards to this topic. So this is the outline of my presentation. So we go through a brief overview, what ketogenic metabolic therapy is, and then what's the rationale behind KMT. Let's just call ketogenic metabolic therapy KMT so that we won't have a hard time pronouncing it, okay? And then what's the role of KMT in medicine? And specifically, I would like to present to you about its important role in reversing metabolic syndrome, or otherwise known as insulin resistance. And also, we will be talking about the role of KMT in neurological disorders. This in itself is a very long topic, so I'll just be presenting mostly the most significant studies, especially the systematic reviews and randomized controlled trials, so that we won't spend so much time given the limited time we have. And then we will also be talking about the use of KMT in other uses, its other uses in medicine, specifically cancer therapy, and then what are the current research and future directions in KMT. I'd like to show you this slide by my most favorite motivational speaker, Brian Tracy. I learned this a lot from him way back, this concept about zero-based thinking, because this is important for us all, especially when we want to continuously improve in our lives, because we need to be open-minded about everything that is being fed to us, especially the knowledge that we encounter along the way, because if we do not have KNI, which is continuous and never-ending improvement, we actually stop growing. And when we stop growing, we start dying. Okay? So this zero-based thinking has the presumption always that whenever we think about something, like me when I treat my patients, I always base it on knowing what I now know, because that's how I tell my patients, knowing what I now know, is there anything that I need to be doing now that I need to stop doing now so that I can continuously improve upon myself and how I treat my patients. So part of my disclosures also is like this statement by Stephen Fry about zero-based thinking. Knowing what I now know, I would never have done anything so fatuous or silly, but then I would never have known what I now know had I not. So it's like learning from our past mistakes, okay? Especially as doctors and health professionals. So I also need to disclose that in our life drama, there may be many expectations that are different from the realities. So like, for example, I'm putting this as an example. We think that when we were college students, then we have assignments and we have sleepless nights, and then afterwards, graduating, we don't anymore have assignments to do and no more sleepless nights. But then the reality is we have more and more and more assignments and sleepless nights actually after graduating from college. Okay, so I need to disclose also that I run the Low Carb Health Doctor platform. You can access it through the URL www.lowcarbhealthmd.com, and www.lowcarbneurologist.com. This is a global advocacy platform that I've been running for the past 3 years for my low-carb advocacy. And I also need to disclose that I have social media presence and podcasts. Okay, so let's go to the overview of what ketogenic metabolic therapy is. Okay, so first, it is a therapy. So by that word, it is a tool that we use for treating something, a therapeutic tool. So in reality, it is a medical nutrition therapy that is meant to address and even reverse certain health conditions. So it can be rightfully called a therapeutic diet, the ketogenic diet. Okay, so it is ketogenic because it aims to attain a consistent level of nutritional ketosis, which is physiologic, not pathologic. And then it is metabolic because it focuses on targeting certain metabolic pathways in biochemistry and pathophysiology of the organism or the human body. So many people have asked me for the past 3 to 4 years what brought me here. So let me share to you a little snippet of my background. So this was me when I was age 23. Okay, I was an intern at that time. And then, yeah, that was me there. So I think that would be a better representation of my body build at that time. But then, when I was in my 30s, this was what happened to me. Okay, by that time, my body mass index was continuously going higher and higher, and I think that was my highest somewhere thereabouts at 28. Okay, so you can see my tummy, and I'm sure many of you can relate because obesity and overweight is really a big epidemic in the world already today. So it's like this. This is a common scenario for us all worldwide. Everybody is getting bigger and bigger, especially when you're already in your 30s. And then you think that it's natural and normal because everybody is growing bigger as well. Okay? So my wake-up call came in my late 40s because by that time I realized I developed metabolic syndrome. We'll talk about this in more detail a little bit later. But the problem is I had cognitive dissonance, or it's like what I learned in the past years was conflicting with what I was learning presently, because all through those years since my late 20s, I had been on a near perfect plant-based what is called a polopeci vegetarian diet. So that means I was just eating plant-based foods, vegetables, chicken, fish for my white meat consumption, and then egg whites, hoping that I will not become like my father. My father was a doctor here in Cagayan de Oro before, but unfortunately, he had his first heart attack at age of 52. And eventually, while I was in my neurology residency, he passed away from a massive heart attack at the age of 62. So that was a very young age, really. So because of that, I didn't want to follow his footsteps, and I was very, very strict with my diet ever since. So what later on became my transformation was from a BMI of 28.2, I became BMI somewhere thereabouts at 23 in just a matter of 2 to 3 months because of TCR or KMT or LCHF, LCHF being the low carbohydrate, high healthy fats dietary protocol. So it can also be called in metabolic health circles as ketogenic metabolic therapy or KMT, the title of my presentation. So I successfully reversed the process, which was the other way earlier. Okay? And I base it on my personal, scientific, and clinical journey I call it personal because I have experienced it myself, and I have been persistently doing it for the past 3 to 4 years. I call it scientific because there has been a whole gamut of evidence towards this. And I call it clinical because I have many patients whose metabolic syndrome I have successfully reversed for the past 3 to 4 years, not just mine. So I'd say, in my own experience, it's almost 100% effective. I'd say almost 100% because those who did not succeed, because the simple reason is they did not follow the ketogenic diet protocol. Okay? So, BMI. We need to know this also, BMI. I was talking about BMI earlier. How do we calculate BMI? It's our weight in kilo divided by our height in square meters. But then, a caveat, here in the Asia Pacific region, the WHO has its own, it came up with its own definition of BMI with lower cut-offs. And this is it because the normal BMI based on the 1998 worldwide WHO criteria, normal is like 18.5 to 25. But then in the Asia Pacific body build, even those who are with BMI of 23 already has signs of or associations with risk factors. So that's why the Asia Pacific perspective lowered down the BMI. So the overweight is now between 23 to 24.9, and then the obese class 1 and above is 25, way lower than the 30 cutoff for the global, which is helpful because the associated comorbidities with obesity is more prominent, especially among among the Asia Pacific population with a lower cutoff for obesity, which is 25. And what are these comorbid risk factors? So it's stated here, those with greatly increased health risks associated with morbidity will be type 2 diabetes, for example, dyslipidemia, specifically hypertriglyceridemia. And then moderately increased, that is important for this discussion, will be coronary heart disease, coronary artery disease, heart attacks, hypertension, and also mildly increased will be cancer. I will talk about later also. So what about the science of ketogenic metabolic therapy? For the past 2 decades, there have been more and more publications relating to the science of the ketogenic diet, or KMT, in PubMed. So it has been continuously growing for the past 1 to 2 decades. And for instance, in this paper, which is a review article, it is all about the ketogenic diet for human diseases and the underlying mechanisms and potential for clinical implementations. I labeled the PMID, or the PubMed identifier, so that if any of you would like to read more about this, you can easily search it in Google. And in terms of open-mindedness, it is a matter also of unlearning the things that we have learned in the past, which may be errors, and also rethinking the things that we know. Because when I first came into this, I really had a lot of conflicting ideas in my head, and I need to unlearn and rethink a lot. For example, it is the case that the food that we are eating can be either the safest and the most powerful form of medicine, or it could also be the slowest form of poison in your body right now. So, I need to introduce to you Professor Dr. Tim Noakes. So, Tim Noakes is an emeritus professor in sports medicine in South Africa at Cape Town University. So what's relevant about Tim Noakes was that he is one of the foremost sports science medicine practitioner in the world today.
And he was actually one of the big proponents of carbohydrate loading for athletes before, like marathoners, because he himself was a marathoner. But the problem is about 15 to 20 years ago, Tim Noakes developed diabetes and metabolic syndrome. He became fatter and he was growing bigger and bigger, like what I had. And then he eventually realized that he did something wrong in his diet, and he was able to reverse his metabolic syndrome and diabetes condition using the ketogenic diet, or the KMT, or Therapeutic Carbohydrate Reduction. So much that for the past 10 to 20 years, it is no longer an issue, and it is no longer considered, like, for example, a controversy, because the ketogenic diet is now officially scientific, because it actually has a medical textbook already, which is authored by Professor Tim Noakes and his collaborators as editors. So the title of this book is Ketogenic, the Science of Therapeutic Carbohydrate Reduction in Human Health, in its first edition. So let me emphasize, it is all about the science of therapeutic carbohydrate restriction in human health. Okay? So I always tell everyone asking me about KMT, is that scientific? And then I say, okay, yeah, it is. You read the textbook on KMT by Professor Tim Noakes and his cohorts. Later on, because he learned a lot of things afterwards, Tim eventually came up with his next book, The Lore of Nutrition, which is all about challenging conventional dietary beliefs. Specifically, the low-carb diet versus the low-fat diet. Because overall, the low-carb diet is the truly healthy diet for human beings. So you can learn more about Professor Tim Noakes. I have a specific page dedicated for him and all his works in my website. It's there. Okay. So according to Tim Noakes, the low-carb, high-fat diet is the new medicine, and this is going to take about 20 to 30 years probably to get accepted, because it is not really very mainstream right now. But as far as our health and the health of our patients is concerned, we better accept it today and learn more about it, because we haven't got 30 years to wait for medicine to catch up. And there are so many people dying from heart attack, stroke, and all metabolic syndrome complications without really knowing why they are dying. And that's the reason why I'm very much into this advocacy, because my own father, who was a doctor, died from heart attack at age 62 because of the wrong diet. Okay? If you remember, way back like in the 1960s, smoking cigarettes was once an in thing. And then even Camel had this advertisement in Newsweek and Time magazine that more doctors smoke their brand. Because at that time, everybody or most people were thinking that smoking cigarette is healthy. But then, through the years, there have been so many evidence already. So now, this is mainstream, that smoking kills. And this took something like 20, 30, 40, 50 years for mainstream to adopt. Okay, this is an example. Because today, we can safely say that sugar is now the new cigarette. So it means sugar is actually a toxic substance, sucrose. And it is also safe to conclude that sugar definitely kills. Okay? So, what's the rationale behind ketogenic metabolic therapy? So, when we talk about low-carb diet, it comes as a spectrum. Okay? So, from a little bit liberal low-carb to the very strict low-carb diet. When we say very strict low-carb ketogenic diet, the range is between 20 to 50 grams per day. Okay, so imagine 1 cup of rice is 40 grams. So you have an idea. Or 1 slice of loaf bread or 1 pandesal bun is 20 grams. So more or less you have an idea how low do we need to get. So the ketogenic diet also is part of this spectrum. So the most strict kind of ketogenic diet would be the strict carnivore dieters, which only eat meat products and eggs. So in that way, they can really restrict carbohydrate to very low levels. And the Society of Metabolic Health Practitioners has this definition of the low carbohydrate ketogenic diet. When we say VLCKD, or the very low carbohydrate ketogenic diet, that's less than 30 grams per day. So to help my patients comply properly with this diet, I have this keto food traffic guide in my website, and I also give this to my patients in the clinic. Okay. So I mentioned this earlier, the rationale. Ketogenic means it's very low carbohydrate and high healthy fat because it mimics the metabolism of the fasting state to induce the production of ketone bodies in the liver. And that is the physiologic state of nutritional ketosis. And when we say ketone bodies, the most common ketone bodies that our bodies use would be your BHB, or beta-hydroxybutyrate, and acetoacetate. So these are the ketone bodies. The physiologic ones would be acetoacetate and BHB. And then these ketones are produced in the liver when we are in fasting or starvation, including intermittent fasting. And because of low carbohydrate intake, the insulin levels are low, and then it promotes the breakdown of fat in the form of glycolysis. So the liver subsequently produces these ketone bodies. So this is an illustration. So in the liver mitochondria, acetoacetate and BHB are produced. It goes to the bloodstream. Part of it is converted to acetone and it is breathed out. But then most of the acetoacetate and beta-hydroxybutyrate are used by our cells for energy in the mitochondria of our peripheral cells. Do you know that the heart muscle, the favorite energy source of the heart muscle is ketone bodies? Okay, and of course the brain, because we are in neurology. That's why I highly advocate for the ketogenic diet, because it is the most powerful fuel for the brain. In fact, glucose versus ketones, hands down, it's the ketone bodies that highly promotes brain metabolism and functions, even improving and at times reversing neurodegenerative diseases. Okay, so this is an illustration. So BHB goes into the brain and it attaches to the monocarboxylate transporter receptor so that it can enter the neurons and the astrocytes. And the mitochondria of the neurons and the astrocytes use it for energy. So when there are cases of neurodegeneration like Alzheimer's, Parkinson's, Huntington's, etc., multiple sclerosis, so there is actually hypometabolism of glucose because of brain insulin resistance, and there is deficiency of energy in the brain, and that's where the ketone bodies exert a significant role because of its restoration of metabolism and the oxidation process. These are the significant studies that have proven that with ketone bodies, the language function of the brain improves, the global cognition function of the brain also improves, as well as the memory. Okay? So let me state a little bit about nutritional ketosis versus ketoacidosis, because many people have been asking me about this. When we say nutritional ketosis, let me reiterate again, that's physiologic. It is actually helpful for the body and the brain and the heart muscles and many other cells in the body because they are also anti-inflammatory signaling molecules. When we talk about ketoacidosis, that's extremely high levels of ketones, somewhere beyond 5 millimoles per liter and above. Okay, so lower, the nutritional ketosis begins at 0.5 to 3 millimoles per liter, and that's helpful for our body. We usually associate ketoacidosis with type 1 diabetes and alcoholism. But it is an entirely different thing. It doesn't mean that if you go on a ketogenic diet, then you will go into ketoacidosis, because what you are after is nutritional ketosis. Okay? So what are the medical uses of the ketogenic metabolic therapy? So, metabolic syndrome, I mentioned this earlier. So what in the world is metabolic syndrome? Many of us worldwide are seeing this. We look left and right, we go to the mall, many are getting overweight and obese. Okay? So in Fiji, this is a photo from Fiji. In the Polynesian area, it's one of the highest levels of obesity in the world, and diabetes also. So the obesity, which is a portmanteau of diabetes and obesity, is actually a massive global scourge of epidemic proportion right now. That's why many people are dying from heart attack and stroke. And sad to know that even obesity is being pedestalized right now. Many say that it is normal to become overweight and obese when you are becoming older because of poor metabolism, etc. But then let me reiterate, it is not, because if you have poor metabolic health, then you are more likely to die from stroke and heart attack. Okay, so this is in northern Mindanao. This is a figure from the World Obesity Site. So 33.9% of people here in northern Mindanao are overweight or obese. And in Misamis Oriental, it's about total of 40-something%. That's significant, okay? So, in terms of metabolic syndrome, I would like to introduce you, if you haven't remembered, this scientist, Dr. Gerald Reven. Dr. Gerald Reven was the Banting lecturer for 1988 of the American Diabetes Association. And his lecture was all about the role of insulin resistance in human disease. So if you remember Syndrome X, that was first described by Gerald Reven. Okay, so what's with this? Metabolic syndrome is a constellation of non-communicable disease entities that, when lumped together, significantly increases one's likelihood of having stroke, heart attack, and worsening diabetes and its complications. So in 2005, the American Heart Association and the NHLBI issued a scientific statement defining the criteria for metabolic syndrome. And this one, you can find this in my website. It is any 3 or more of the following criteria. I reached a perfect score of 5/5 because my waist circumference already was beyond 90 centimeters. I already developed high blood pressure, about 104/90 at that time, because the cutoff is 130/85. And then triglyceride cutoff for metabolic syndrome is 150. You can see this in the lipid profile of your patients. High blood sugar, fasting blood sugar should not exceed 100. Okay, remember that 100, not 126. So even pre-diabetics, that's already part of the metabolic syndrome. And then low HDL cholesterol. For men, my LDL cholesterol went as low as 32. So I was a perfect score in this at that time, about more than 3 to 4 years ago. And then what is its prevalence worldwide right now? So in this paper from the American Diabetes Association, using the International Diabetes Federation definition, in men it is as much as 26.4%, in women as much as 19.4% worldwide. That's a significant issue. Okay? So we need to understand also, if you have heard of insulin resistance, that is interchangeable with metabolic syndrome, because metabolic syndrome is the insulin resistance syndrome, and the NHLBI has already acknowledged that. Okay? So, important terminologies, I need to help you run through this. Biochemistry, physiology. So, if you have glucose, So our body can convert glucose to glycogen in the liver and in the muscle for storage of energy. So you call that glycogenesis, okay? And the process may be reversed. Our body can break down glycogen into glucose or using the glucose as energy, and that's called glycogenolysis, okay? And then glucose can be converted to fatty acids in the liver and in the adipose tissue, and that process is called de novo glycogenesis, or DNL for shortcut. And then these fatty acids can be combined with glycerol as the backbone to form triglycerides or triacyl glycerol in the process called glycogenesis. And then our body, and this triglyceride is either stored in the adipose tissue or in the liver. That's why many people have fatty liver disease nowadays, eating lots of carbohydrates. These triglycerides can be broken down into fatty acids and glycerol. The reverse process called lipolysis. Okay? And then there are certain substrates that can be converted to glucose using the process of gluconeogenesis. Okay? So why am I showing you this? Because insulin has a big role here. Okay, pay attention to this insulin. Okay? Perhaps most of us doctors are just aware of insulin, the injection, the subcutaneous thing, etc. And insulin is meant to lower glucose levels. But then, what is the effect of insulin to our body? So those with checks here are the processes that insulin promotes. Because insulin is an anabolic hormone, it is there to help us store energy. And then the way that we can store energy if we eat glucose is to store it in the form of glycogen and fats. So insulin promotes the conversion of glucose to the energy storage form. And then inversely, it also inhibits the reverse processes. It inhibits the formation of glucose, the breakdown of glycogen, and the breakdown of fats. So that's why if you have high levels of insulin, you will grow faster and faster and faster. There's no other way. That's the science. Okay? So what is the crucial role and mechanism of insulin resistance in metabolic disease? This is important for us all to understand. This is a paper in Frontiers for Endocrinology last 2023. So, chronic metabolic disease can be induced by insulin resistance. What are these chronic metabolic diseases? You have heart attack. You have, of course, diabetes mellitus. Tumors, because insulin is a growth factor, including insulin-like growth factors. They can promote the growth of tumors. In the central nervous system, you have brain insulin resistance. Many patients are now having dementia, Alzheimer's disease, etc. Many people are having fatty liver disease, which is of the non-alcoholic nature, NAFLD or MASLD, NASLD, and AFLD. Chronic kidney disease is mostly due to diabetes and hypertension. You have polycystic ovarian syndrome because of insulin resistance in the ovaries of women. Okay. So what are the molecular mechanisms? I removed many of my slides because those are molecular biology, and I think it's gonna be a headache for us. So I'm just doing my best to simplify these things for us all to understand it easily. So what are the cellular and molecular mechanisms of IR or insulin resistance? Clinically, we see patients needing higher levels of insulin so that normal glucose levels or blood sugar are attained. Okay, that's our common mainstream knowledge. In the cellular level, insulin exerting insufficient strength. That's why glucose levels tend to go higher, because the signaling in the insulin receptor downstream has a defect, okay, or there's a problem somewhere. So, like for example, I'd like to show this briefly. This is the insulin receptor, or the insulin receptor tyrosine kinase, IRTK. So there are signaling molecules here. So for example, when insulin binds to the receptor, then this cascade is activated, and eventually the glucose transporter is translocated to the surface so that glucose comes in. So anywhere along this pathway, there could be the development of insulin resistance. Okay? So this figure here illustrates, I'd like to show you this figure because of the central role of the dysfunction of the mitochondria, especially in the development of insulin resistance. Because with dysfunctional mitochondria, you can promote reactive oxygen species, and there is a problem in the pathway of the signal transduction, and then that could lead to insulin resistance. Okay? So this is quite a busy slide, but this simply illustrates that in insulin resistance, you have more fatty liver, you have more fat deposition in the adipose tissue. There could even be fat deposition in the muscles already, and also fat deposition in the pancreas. Okay? So thereafter, you have dysfunction of your fat adipose tissue, and this further promotes insulin resistance in the muscles, in your cardiac functioning, and cardiac muscles in the liver and in the pancreas. Okay. So these 4 slides I need to show you because many people are not familiar with this. So there are 3 kinds of food that we eat: carbohydrates, proteins, and fats. And these are the specific insulin responses for each. This one is for fat. So if you look at it, it's not so much. The elevation of insulin is not so much. But when you eat protein, it goes up a little bit higher. But then glucagon is also secreted, so as a counter-regulatory hormone to insulin. So it doesn't really matter that much. What matters most is carbohydrates. This elicits the highest level of insulin response. Okay, so if we superimpose the 3 macronutrients, it's really carbohydrate that elicits the highest insulin response. Okay, so imagine eating carbohydrates the whole day and your insulin repeatedly goes up. You will eventually develop resistance to the effects of insulin. So for this slide, I use it to explain to laymen. When you eat food, especially high in carbohydrates, you produce more insulin. You do that repeatedly, you do that chronically, you have significantly elevated insulin all throughout the day, from morning till night and back again. Your cells begin to resist the effect of insulin, and then you get to develop eventually metabolic syndrome manifestations because this vicious cycle just goes over and over again, and then you develop all the complications of metabolic syndrome later on. I need to disclose and share to you also Dr. Joseph Kraft because he is the father of insulin resistance. Many doctors haven't encountered him because his research was somehow forgotten. But then, this was his paper sometime in the 1970s to the 1980s. So, in summary, many people, before the development of diabetes or pre-diabetes with blood sugars, fasting blood sugars below 100, already have significant elevations of insulin. So, these are the 3 types of insulin resistance patterns that have been documented by Dr. Joseph Kraft. So this will eventually develop into full-blown diabetes. Okay? And then you can learn more about Dr. Joseph Kraft also in my website if you want to learn more about him. So I'm showing you this because we need to rethink and learn what we have known about insulin in the mainstream, because insulin overall is not totally a nice hormone. It promotes the storage of fat. It promotes tumor growth also. It is an inflammatory hormone. So when you avoid high carbohydrate intake, you tend to keep your insulin down and you avoid the manifestations of insulin resistance. Okay? And I need to show you this because worldwide the top 10 causes of death is heart attack, stroke, and many other non-communicable diseases that are related to metabolic syndrome. This was in 2019, and this is the most recent. COVID is included because it's COVID times, but still it doesn't change the fact that most of these are metabolic syndrome-related complications. And here in the Philippines, the top 1, 2, 3, 4 are actually metabolic syndrome complications. Most people are dying from heart attack, from cancer, from stroke, from diabetes, and all its related complications. So, that's why I always tell everyone, especially my patients, that metabolic syndrome is the #1 killer worldwide and even here in the Philippines today. So, if you don't want to die early from heart attack and stroke, I always tell everybody, avoid insulin resistance. Okay? So what are the beneficial effects of the ketogenic diet in metabolic syndrome? I'll show you this systematic review. This is top-level research, systematic review. So in this paper, there is significant improvement in weight loss, so on and so forth. But then this is quite an eyesore, so I'll show you this figure. For those following the ketogenic diet with metabolic syndrome, the weight significantly goes down, body mass index significantly goes down, blood pressure significantly goes down. I have many patients who are no longer on medications just because of the ketogenic metabolic therapy protocol. Triglyceride significantly goes down, even LDL. HDL cholesterol, or the good cholesterol, goes up significantly. AST and ALT, being manifestations of non-alcoholic fatty liver disease, also significantly goes down. And of course, blood glucose and HbA1c, levels of insulin and the HOMA-IR index also goes down. So it's like a miracle cure. But then, if I was not able to prove this in my own self and many of my patients, it would be hard for me to understand. This is a systematic review. Okay? You can look at it in the PMID and Google. So, I'm also showing this paper, Alternative Dietary Patterns for Americans, especially the low carbohydrate diet, because this nicely summarizes the effect of low carbohydrate intake. Because in terms of the spectrum of insulin sensitivity and insulin resistance, carbohydrate intake plays a very, very big role, and it is only modulated by certain factors like your genetics, your age, the way you do your day-to-day activity, like exercise, the quality of the carbohydrate that you eat, like low or high glycemic index carbohydrates, and also your sufficiency of sleep and stress. Okay? So let's go to neurology, because this is a neurology conference. So what is the role of KMT in neurology? Okay, so let's talk about stroke. Okay, so you have ischemic and hemorrhagic stroke, and this paper was written by Anthony Davalos and his collaborators. You remember Davalos of Citiculin? Okay. So in this paper, he outlined what are the effects of insulin resistance that eventually leads to stroke. So there are abnormalities in the metabolism of glucose, impaired triglyceride levels, elevation of blood pressure, then vascular reactivity abnormalities like your endothelial damage, for example, and inflammation that is subclinical. And you also have the development of a pro-thrombotic phenotype that promotes clotting. So all of this leads to both kinds of stroke, ischemic and hemorrhagic. In this paper, it is nicely illustrated what are the odds ratio of developing stroke, MI, or both stroke or MI when you have metabolic syndrome. So it's very high, more than 2 times. And if we show this in the forest plot, it really is significant. So if you have metabolic syndrome, at least you have 2 times higher chances of dying from developing stroke or MI. Okay? So these are individual components of the metabolic syndrome. So each component is even able to increase the likelihood of having stroke by itself alone. Okay? So these are the forest plots of those ratios. So this paper summarizes metabolic syndrome and the risk of ischemic stroke. So it's still significantly high. This is specific for ischemic stroke. Okay, it's 1.3 to 1.8 times higher. So, why is it important and what is the role of the ketogenic diet? There are already lots of papers about this. So, in this particular paper, it discusses ketogenic diet and ketone bodies against ischemia and reperfusion injury, like ischemic stroke. So, I won't go into the details of this because these are all biochemistry, just words. I would like to show you this figure here. So ketone bodies, especially for example in ischemic stroke where there is ischemia and reperfusion, and other presenters have already mentioned this pathway before, including I think many other presenters yesterday. So what is the role of ketogenic diet and the subsequent production of ketone bodies? It inhibits reactive oxygen species and free radicals, and it also inhibits part of this ischemia and reperfusion signal transduction pathway, so that inflammation and cell death or apoptosis is significantly avoided. Okay? So in this paper, ketogenic diet provides neuroprotective effects against ischemic stroke, and I'm showing this because it is much easier to understand in this figure that the ketogenic diet helps one avoid excitotoxicity, oxidative stress, and cell death or apoptosis, especially in one with ischemic stroke. So it's like Idarabo. You remember the lecture yesterday? So ketone bodies is much like how Idarabo works. Okay? So how about in other neurological disorders? You think it's just stroke? No, it's just the tip of the iceberg. So this paper is all about the therapeutic role of the ketogenic diet in neurological disorders. This was published 2 years ago, and it states that for the moment it seems that KD can provide therapeutic benefits in those patients with neurological problems because of its antioxidant processes and the way it modulates inflammation, so on and so forth. Okay? So in conclusion, there is evidence that the ketogenic diet can provide therapeutic benefits in patients with neurological problems associated with oxidative stress and inflammation, like in stroke and Alzheimer's, Parkinson's, etc. So this figure nicely illustrates the whole spectrum of the ketogenic diet in relation to neurological disorders. So what does the ketogenic diet or the subsequent nutritional ketosis does? It reduces oxidative stress, it decreases inflammation, it enhances mitochondrial function and mitochondrial bioenergetics, and to a certain extent it also improves gut microbiome. So in so doing, since Parkinson's, epilepsy, Alzheimer's, migraine, and depression have common mechanisms related to mitochondrial dysfunction, that is the precise reason why ketogenic metabolic therapy does wonders for many patients. Okay. So last April, there was this global metabolic health conference, and me and Dr. Matthew Phillips were in the panel. It's just two of us neurologists that were in this conference. So I'd like to cite Dr. Matthew Phillips because he's one of the neurologists worldwide that I really highly salute in terms of metabolic health. This is Matthew Phillips. He is based in New Zealand, but he is a Canadian. And his foremost passion is the exploration of potential therapeutic benefits of metabolic strategies, particularly fasting and ketogenic diet. So he is the author of, this was my presentation at that time. And what's the coverage of ketogenic diet for the brain? All of this, I mentioned this in passing earlier. So I'll just go through them in passing one by one so that if you have any other questions, you can ask me later. So what about epilepsy? I wouldn't like to go into more details in epilepsy for a lack of time, but this has been around for so long already, for 1 century, because Dr. Russell Welder of the Mayo Clinic has started ketogenic diet for epilepsy since the 1920s. In fact, there are already many meta-analysis and randomized controlled trials to prove this. You can ask the pediatric neurologist here. Okay, so I wouldn't go into the details of this. So there is already the Charlie Foundation, because the son of Jim Abrahams was healed of his epilepsy in his younger years. That's Charlie. That's why they have the Charlie Foundation for ketogenic therapies. So these are the mechanisms. I mentioned this already earlier. So what about dementia and Alzheimer's disease in particular? There are already a number of randomized controlled trials. One is by Matthew Phillips and collaborators. Okay, so in this paper, brain insulin resistance in type 2 diabetes and Alzheimer's. It is a conundrum still, but we have to understand this conundrum so that we can apply it in our practice. Still, insulin resistance of the brain, and it states here that type 2 diabetes increases the risk of this dementia and stroke. Brain insulin resistance is a significant contributor to this, and type 2 diabetes is significantly associated with this also. So in this paper, there is a movement now to call Alzheimer's as type 3 diabetes. The evidence has already been reviewed, and it is concluded that type 3 diabetes accurately reflects the fact that Alzheimer's disease is a representation, a form of diabetes selectively involving the brain, and that is why it's called brain insulin resistance. Okay, these are the mechanisms. I need not go through them in detail. I have talked about that earlier already. And then in Parkinson's disease, there are also studies like Matthew Phillips already has a randomized controlled trial of 47 patients relating to Parkinson's and the ketogenic diet. And this is his randomized controlled trial. And he got this conclusion that it is safe to use for Parkinson's disease patients with significant improvement in non-motor symptoms. Okay? And this is the mechanism. Similar inflammation and mitochondrial function improvement. Also in MS. Okay? In MS, there are some studies already, similar mechanism. And then migraine. Okay. This is a meta-analysis of nutritional ketosis and migraine. And the outcome here is significant in terms of significantly lowering the headache attacks in migraine, notwithstanding whether it's endogenous or exogenous ketosis. Okay. This is Dr. Angela Stanton. She is a PhD in neuroeconomics, and she runs a Facebook group of migraineurs, more than 10,000 members, and she is using low carbohydrate protocols to control migraines with very, very significant improvements. And she came up with this book, The Complete Guide to Treat and Prevent Migraines Without Medications, and using only the low carbohydrate diet protocol. What about mental health? Okay, this is Dr. Georgia E. She is a Harvard-trained psychiatrist, and she came up with this paper, a retrospective analysis of 31 patients with mental illness. And these are the results. Improvement in the Hamilton Depression Scale, the Montgomery Depression Rating Scale, and as well as the KNSS. And in conclusion, not just that, there's an improvement in metabolic health parameters, and in conclusion, ketogenic diet was well attributed to this paper. And there's also Dr. Shivani City of Stanford. She is also active in the metabolic psychiatry space, and she made this review. Essentially, the same improvement in brain function because of reversal of insulin resistance in the brain. improvement of inflammation parameters, as well as improvement in mitochondrial function. Okay? So what about cancer? Okay, you can ask me this later. Many of you are interested about cancer because Professor Siegfried came up with this paper in 2015, Cancer as a mitochondrial metabolic disease. So the main issue here is using oxygen in the mitochondria. And in a cancer cell, since the mitochondria is damaged, it cannot use oxygen, so it needs a pathway to use energy in the form of glucose through fermentation or anaerobic respiration. So all cancer cells will not thrive using aerobic or oxygen respiration because the mitochondria is damaged. That's why they produce lactic acid, and it uses glucose mainly as a substrate. So, in other words, if you cut off the supply of glucose, cancer patients will live longer. Okay? So, you remember the Krebs cycle in the mitochondria. Okay? So now, Professor Siegfried has this stress pulse protocol, and I am actually using it in rural patients who have approached me. And the latest one last week I had is an ovarian cancer recurrence patient after 1 month of stress pulse protocol using ketogenic metabolic therapy plus mebendazole. The tumor shrunk from 10 by 10 by 10 cm to 9 by 9 by 9 cm using only stress pulse protocol. Okay. So this is Professor Siegfried, and this is my podcast with it. You can watch it in my YouTube channel. Andrew Scarborough is an astrocytoma patient who survived more than 10 years on ketogenic metabolic therapy. And this is Pablo Kelly with glioblastoma multiforme. He's a neurosurgeon here at Val. So this patient survived more than 10 years with glioblastoma multiforme. We neurologists and neurosurgeons would think they will not survive long. Okay. So mitohormesis. I think I'll not talk about this much anymore because it's kind of a difficult topic. But essentially, talks about improving mitochondrial function so that eventually the mitochondria will improve. And this is applicable for neurodegenerative disorders. Okay. Okay. So because we are running out of time. So, to wrap up this discussion, there are things that we need to unlearn, like this USDA food pyramid, wherein 60% of the carbohydrates is recommended as a guideline. This is actually killing most people in the world today. And according to this meme, the classic food pyramid, wherein 60% are carbohydrates, we need to change this. Actually, if we cut off the top and the bottom, that's the healthy part of it. Okay? And if we join the top and the bottom, it becomes accordingly by this meme, the happiness paper hat is addictive. Carbohydrates are addictive, and including sugar. So this is the food pyramid that I highly recommend to everyone, including my patients. The ketogenic food pyramid. 70% will come from healthy fats, 25% from protein, and 5% from carbohydrates. And this is the core of ketogenic metabolic therapy. So what are the future directions now? This is a grassroots movement. So we have the Society of Metabolic Health Practitioners worldwide, which is the one and only voice now for global metabolic health. I am collaborating with them. I'm showing this because Roblox was developed by David Bazuki. He is the developer of Roblox, and he is, I think, currently worth $3 billion. Why I'm showing this? Because their son, Matt Bazuki, developed bipolar disorder, and because of ketogenic diet, or KMT, administered by Dr. Christopher Palmer and Dr. Georgia Heath of Harvard, he got cured of his bipolar disorder. This one, Matt Bazuki. And because of that, they are now sponsoring much of the research in this space. same metabolic mind. Okay, so there's the Charlie Foundation I showed you earlier, which is supporting metabolic research. Also, Nutrition Network of Think Notes, the European Keto Center in Switzerland, which is co-founded by Professor Tom Seyfried that I discussed earlier. And this is Low-Carb USA, and there's already a movement in Australia, Low-Carb Down Under, and they are giving regular presentations in metabolic health. In the Philippines, we already have the National Low-Carb Day, so I'm inviting you all this October 6th at Ortigas at the Metro 10 complex, because this will be the third annual gathering of metabolic health advocates here in the Philippines. So all of this is just an eye-opener. I'm just touching the tip of the iceberg. It's up to you to self-learn. You can go to my website and read more about it and apply it in your own life and in your patients if you want. So according to Gary Fetke, a friend of mine, an orthopedic surgeon in Tasmania, the most important thing is that once you see the health benefits of the low carbohydrate, healthy fats diet protocol, you can never unsee that, especially if you apply it in your own life. And when I asked Gary why did he persist in doing this for his patients, despite the fact that the Australian Health Practice Authority filed a case against him for malpractice more than 15 years ago, he simply told me, I'm doing this because I know I'm doing the right thing for myself and my patients. It's about doing the right thing. In this way, we are helping our patients live longer and healthier lives. Okay, so thank you for your kind attention.